contributors to this series, and TB is surely a very important disease. There's no debate about it, no question about it. I just would like to share a couple of experience from my previous life, because we have a very good, you can be the judge, Mario. I work in Hong Kong, and we had a pretty good TB DOTS program. But then, there are things, as the community change and modernize, the way of people's life change, there are things we need to watch out for, and we learn a couple of lessons. And the movement of people, and this is going back to the cross-border issue. In Hong Kong, many people move across the border to work in China, and then China mainland came to Hong Kong. Now, if you move around like this, the traditional model of delivering DOT is problematic. You require the patient to be going to the clinic every day. So either the patient give up the job, or eventually what we did was, of course, we come up with a model to give them a supply of medicine so that they can go and do their job across the border and come back every week and whatnot. But then it goes into another problem, compliance. So these are things, when you solve one problem, you find another new problem. We also learned one thing from the private sector provider. And in countries where you have private sector provider, if it is an unregulated private sector, you have more problem than you think. Because they will not listen to the ministers of health. And they will not listen to the WHO and not to use our protocol. So WHO has no lien on private sector. So that's why we really need to have a look at the different countries' situation. And Rifat is correct. There is no cookie-cutter approach to solve the problem. And I visited one country. It's really interesting. I forgot which one now. Just as well I don't remember the name. But it's a good example. They engage practitioners in the private sector to provide service so that the patient has a choice. But the country make it sure that they are the supplier of quality medicine, making sure that they are not being sort of affected by substandard medicine. So these are just some reflection on what is happening on the ground. And I'm sure colleagues in the audience, you are the practitioners in the field. You know better than those of us now who are sitting in the office. So that's why there's a lot for us to learn from you. Tito, nice to see you again. Okay.
Thank you very much. We're going to draw this evening to a